Welcome to the Dental Marketing Guy show. I'm Justin, the Dental Marketing Guy, and today I am very honored to have a rising star in the dental industry, Dr. Angadi. What does Dr. Angadi do? Let me tell you, she helps you become a better leader. And how does she do that? Well, she has a certification in social and emotional intelligence. She's been practicing since 2007 as a dentist, and she's discovered throughout her practice just how many challenges you face and that she faced. And she was able to find solutions to these problems by using things like empathy and communication, just really taking things to a whole new level where, treatment planning, case acceptance, team building, all the things that, I talk to a lot of dentists, and these are the things that really are the biggest challenge is I can talk to a dentist about SEO or web design, videography, photography. We can talk about marketing, and there's this level of interest. It's like, yeah, this is interesting. I want new patients. This is nice. But then we get into practice management, which I don't really myself, I don't specialize in, but I start dropping names and I start saying, have you thought about working with this person? And their eyes light up and they're like, oh man, if I could just get my team to be on the same page, if we could all be drinking the same Kool-Aid, so to speak, and it's so important. It's such a big deal because no matter how many new patients you may get from Google or wherever, if there are problems in your practice, all those new patients, all that new business could just end up being a bigger headache. So that's why I've brought you on, Dr. Angadi, and I would love to hear the story of how and why you became a dentist and how you became known as the inspired dentist. But first of all, how are you doing?
I'm doing well. I'm excited to be here. Yeah. I mean, I've been a dentist since 2007. And just like every dentist graduating from dental school, it was visions of, excellent patient care and helping the world and doing good and staying true to what you think is, your values and all of that. And you get out in the real world and it becomes more challenging than you think it's going to be when you leave as a clinician from dental school. And through my process, I associated for a bit. I learned a lot in that process, mostly good, some challenges. And, it led me to buying a practice back in 2013. And what I found is as I bought the practice and went through the transition of becoming a business owner, there's a whole different way of communicating with your staff and yourself. And the level of stress is essentially different. It's not necessarily worse or bad, but when things are dependent on you and your vision, it's a lot more pressure to, get that practice up and going and doing the right thing. And for me, it got overwhelming. I trusted some wrong people. It wasn't as widespread, the social media stuff that's going on, as far as great people out there like you, as far as giving tips and tools on how to start off on the right foot. So, trusting the wrong people, taking advice where I got it, it led me to a really dark place. At the same time, within a year of buying my practice, I had my son. He was very young. It was just a really tough time. There was not really an outlet for me to find out what to do, how to grow this practice, how to be a better leader. It was leading me to what I look back at right now, early burnout, possibly some depression. It was a dark place. And I was seeking answers. I was getting consulting with a big group out there, and I was still frustrated because I thought I was doing the right thing, improving my CE, getting getting all the business skills that I need to get. But why was I still not happy? I would start to see certain things in my practice improving, but I still wasn't happy. And it came to the point where it led me to an amazing community, Delivering Wow community. And even with that, as I went through some of the training and boot camps, things like that, I was still stuck. I had all the tools available and I was still stuck. So that's when I took a step back and I went, you know what, maybe the problem isn't what I'm learning. Maybe the problem is actually within me. And that was a big dose of humility pie. It wasn't necessarily easy to accept because those of us who are dentists are very much that perfectionistic lifestyle. Like we are going to do things perfect all the time, every time. We don't make mistakes. And in this case, it was one of those things that I had to admit that the issue was me, and that's what led me to my journey. So I sought out a coach. I started reading. I started, really connecting with people who were happy, really happy, and not just in the dental field. And it kind of got me thinking, well, what is it? What is it that makes people happy, regardless of whether they're in our field or in other fields? What is that element? And that's when I started digging into social and emotional intelligence, and emotional intelligence specifically, because that awareness of myself was what I was lacking all along. If you have a bad day and things are happening in your practice, or there's a staff issue or a patient issue, it's very easy to go, oh, well, the issue is all because of them, instead of, wait, did I react in that way that would have been better for me, which then in turn reduced my stress, So that's where that whole ball got rolling. So I was on that journey, coached with a great coach. And then I was so inspired by all of it, I went back and did certification myself. So I put myself through the training, nothing to do with dentistry, but there's so much application in our field as far as becoming better leaders, because what I'm finding out is that's where I'm not alone in being stuck, where I was and where I am. And we can be happy practicing. And that doesn't always seem, a lot of dentists don't think that that's possible. And it is possible to practice happy because you yourself are happy, versus depending on everything to go right 100% of the time. So that's what led me here. Now I'm working with dentists and clients that are looking to be better leaders, more in touch with themselves, who they are, and unpeeling all these expectations that they take on in that path of becoming the business owner that they are.
A lot of people know that dentists have an unusually high percentage, dentistry as a profession has a high percentage of suicides, a high suicide rate. Do you think that's just by chance, or do you think that it has something to do with what you're describing, that place that you were in, and how you came out of it?
I 110%. I'm so glad you said that, because it's not something that everybody wants to think about, but it is something that happens within the field, where there's an element of burnout, and not even physical burnout. Yes, there's occupational hazards with the field, but mental burnout, because most people are practicing alone. They're dealing with frustrated patients. They're dealing with staff dynamics. They're dealing with business ownership coming home and processing all the stresses that come from things not going right. Because think about it, as clinicians, when we go through dental school, who we are when we go in and how we are when we get out are not the same. Because by the time you're done, you are trained to be a very good clinician, down to the margin, down to the millimeter. We want to be and strive to be perfect, to do the right job every time, all the time. But that's not life, right? And that's not a business. Things are going to move. We all think there's a linear pathway from A to B, but really what's happening is it's kind of going at its own way. You're going to get there, but it's not always a straight line. And I think sometimes that expectation that everything is going to be so smooth. We buy a practice. Okay, I'm going to practice the way I want to practice. Well, yes, you can practice the way you want to practice, but are you mentally and emotionally ready to practice the way you want to practice? Because sometimes that means accepting that things aren't going to go right all the time, or that there are things that you need to improve in yourself to become a better leader, or that patient that drove you bananas that day, ended up having something else going on. Did we hear that, or did we just blanket that? These stressors that all pile up really take a toll on us, and we don't necessarily have an outlet for it. There's not really an outlet for it. We go home, we're involved with our families and our home lives, and we just suck it up is kind of the cultural trend, unfortunately, in the field. It's, hey, you know what, deal with it. Tough patient, deal with it. Staff issue, deal with it. No, we have to express it. We have to, get it out there and talk about it. And why is that emotion triggering whatever that reaction is? Because when we start to snowball, that's where I think that depression comes in. When there's no outlet, there's no commonality or connection, it becomes a problem. It becomes a problem. And I think dentistry, a lot of dentists feel alone. And it's silly. It's silly because we go to these CE and conferences and there's so many people, but you can be in a room full of people and still feel alone. You can feel like nobody understands what you're feeling and there's no place to describe your feelings. It shouldn't be that culture. And that's why I'm doing what I'm doing, because I don't think that culture really needs to be done or had.
So what would you say, you said you found Delivering Wow community with Anissa Holmes. She was a guest on the show a while back. We were talking more about Facebook ads back then. But this is very important. I mean, this is more important than advertising and marketing, because this is like, if you get all those new patients, it's just a bigger problem. There's that old saying, more money, more problems.
Right.
Depending on which where you are in the stratosphere, you may or may not believe that. But the bottom line is, if you've got a little headache from a little practice, you could have a big headache from a big practice. What are some of the actionable tips? What would be some of the first steps a person could make? You say, I'm a dentist, I'm watching you, and I'm like, I could see how Dr. Angadi, she's got this system, she's got this way of maybe like a program of some sort. But what can I really gain from this interview right now in terms of taking a first step towards, getting some peace of mind?
I think that the first thing I think that most of us need in the field and help us the most is accepting that when we feel what we feel, that there is a reason for it. So if we are feeling stressed, what is it? Is it truly the patient that irritated us, or was it something else? I think that awareness is the number one thing that people are missing, because once we get that awareness, the things that actually help in your practice are things like empathy and communication and being able to be aware of the situation. Like, these things help us be better clinicians. So with empathy, it's, the patient comes in, when they're telling you what their chief complaint is, a lot of times there's more to it than what they're actually saying. And you can address their needs as far as what they're really wanting from you as a practitioner when you can truly hear what's important to them. Are they just coming in because they say they want whitening? Well, why? And you start digging into, well, why? And it applies even with your staff too. If there's a repetitive problem, well, why is this happening? Why? If we're digging deeper, then what ends up happening is a person that might be coming to you as a new patient for one issue, you may end up addressing issues that cover other things that end up, one, being more lucrative because you're actually addressing what they want and they didn't even know that they want. And two, you connect with that patient. And I think the key with patients is connecting with them, because in this day and age with social media, yes, everybody knows each other, but do they actually connect with each other? And there's, in our field, that feeling of connection is why I think patients stay with you. They like who you are. You can be a great clinician and that's fantastic. All the CE that's out there is great to educate yourself. But at the end of the day, if people don't trust you or connect with you as a human being, then no matter what you're trying to tell them that is in their best interest, it may not make a difference. And that's where treatment planning and case acceptance go up so much higher when I can look at someone chairside and look them in the eye and say, why do you need that? Why are you seeking me out for this, your cosmetics? Why do you think you need to enhance your smile? And it usually leads to something more important. And it's not even from okay, here's a script, let's say it. It's truly being able to look them in the eye, mirror whatever it is that they're talking about, and then addressing what their concern is. And those three steps of listening and then mirroring their emotion and actually being able to give them a solution, I mean, adding that skill to my treatment planning has been huge for my practice, and it has nothing but patient connection with that. And the same thing goes with staff management too. Staff will come to you and they'll say, you know what, this is frustrating, this happened, X, Y, and Z. Are we really listening, or are we just going okay, and then moving it on? So showing that empathetic listening, I think, is like the skill that helps every practice grow, because they're connecting with people, and we're in a people business, regardless of what we want to call this. We connect with people all day long, and the mouths are a very personal thing. And people feel like when they come to us, they're opening up about something that is very personal to them, right? Their mouth is so personal to them. And if they're giving that to you, the last thing they want to hear is how that's possibly not noted. And I think that's a really big skill with that. And then not only being able to do that, but being able to help them understand that communication aspect. It helps with the communication when you're listening, not just regular listening, but empathetic listening, then being able to communicate. Those two tools together really help expand your team management and your patient management, because now you are someone that is seeing the situation and seeing the patient for who they actually are, and being able to address their concerns better. Besides, you want to be the dentist that people go, oh, I really like her, or I really like him. People don't seek out a dentist because of X, Y, and Z. I mean, they can say that you're skilled, that's great, but that's not the number one reason they're seeking you out. When they're asking, hey, Dr. Jones or Mr. Jones, who do you go to? Oh, my dentist is really great. The staff is really nice, and the dentist is awesome. You want that culture in your practice where your staff feels that way, your patients feel that way, and it's amazing how word of mouth goes in that way. I think the other actionable tip, I think, is when you're building these bonds and you're communicating in a better way, you're actually more aware of what situations are coming before they do. And you're more aware of if a patient's going to say no to something, you can almost dig deeper into why they're saying no. Because if you're listening to begin with, talking and having a conversation with them, you can actually address their objections to treatment planning before they actually even object. I had a patient not long ago. She said, my son's getting married and I'm doing, all of these things. I don't have time, to get X, Y, and Z as far as treatment done today, or, treatment done until, March of next year, and I started talking to her and we started digging deeper, and she, what it came down to is she was feeling she was feeling a little slighted about the whole situation, which was a whole different conversation, and I don't expect everybody to go into that point. But when we started talking about the stresses of arranging a marriage and all of that stuff, she felt that connection with me, and lo and behold, she scheduled like within a week. So sometimes they just want to be heard. They're in a place that is not really their favorite place in the world. They want to be heard. They want to know that you understand that, and then when you address their concern and listen to them, it's the best skill that we can have.
And a lot of people, I think with a lot of clinicians, what can happen is they already know the right answer for that tooth or that tooth. They already know the optimal treatment plan. And it's just about bridging the gap between what's clinically optimal and getting someone on board with it. And I think you really touched on a good point, because sometimes when people don't feel understood, they might say no just to set up a wall, just to be safe, because no is safe. No, I might say no to something I want to do to make sure that I have the right to say no, just to check that box, right? And people do that, and they do that a lot. In fact, who doesn't want better teeth?
Right. Right.
But some people say no because they don't feel understood. So I think that, how are you supposed to understand someone if you don't listen to them? Right. And so clinically, what's interesting is clinically listening to someone and bringing them in the treatment planning room and talking about their objections, it's scientifically irrelevant. But how scientific can you really be if you're ignoring the science of human psychology
Mhm.
and treatment planning. If consumer psychology is not interesting to you, well, then get ready to do less dentistry,
Right.
because people are the ones who are going to decide whether you do that dentistry. You need consent. So
Right.
that's really huge, you know. So I think, you know, when it comes to being perfectly logical, part of being logical is understanding that we are not perfectly logical.
Mhm.
And you know, to ignore that is illogical.
Right.
Yeah. So it's a little ironic, but yeah, I mean, if someone feels heard, have you ever, I mean, you gave that one example, but I'm sure as a dentist you've had that where um, you know, they're not accepting treatment, and then all of a sudden they find out that you're a Raiders fan and they're saying yes to everything. I mean,
Mhm.
sometimes people want to feel like they're understood, and
Mhm.
that's really the number one objection.
And it's interesting because we are social creatures. We strive on belonging and acceptance. And that's why social media has gone where it is. I mean, social media is nothing but instilling that feeling of belonging. It's no different in any business that deals with people and connections with people, because at the end of the day, someone feels connected to you, they're going to trust what you're recommending, what you're explaining, what you're saying. It's not about what you're saying, it's how you're saying it. Are you really looking at that person? Are you looking at them just to look at them to explain something? Or are you looking at them and going, I understand that this may seem a little bit scary and possibly unknown, and I get that. And I understand that you might be a little bit afraid of pain or how long this is going to take or the expense. But at the end of the day, I want to help you feel your very best. I want to help you do your very best so you're not worried about your mouth when you go to your son's wedding, smiling on that day, because you're going to have an amazing time. And I'm so excited for you in this new step and new venture in your life. And when that relationship happens and they know that you're coming from a place of connection, I mean, it's so much easier. I mean, there are great scripts out there. There are many tools out there. There's many thoughts on how to treatment plan, influence a patient, whatever else, is out there. But for me, basic connecting, it's psychology. It's what we want as human beings. I mean, when you're in a relationship or when you have children or anything else, what is that feeling? You feel like you bond with other people. And I think that's so important in our field. It really is.
Yeah, you know, I mean, I'm supposed to know something about dentistry, but I'll tell you what, when my dentist shows me the screen of my tooth, I'm not even listening to what he's saying. I'm ready to
Mhm.
say yes. You
Mhm.
know, because I know that he's not trying to buy a new car, as
Mhm.
some people say. You know, why do people feel that way? Who So what if he wants to buy a new car? The fact
Mhm.
is he's being honest with me, and I know that
Mhm.
because of that relationship, because of that connection, because
Mhm.
I know that he's listening to me, like you said, you know, and he's
Right.
not trying to pull one over. And
Mhm.
so it wouldn't really matter how important the treatment is. What matters is how important I think it is and how
Right.
honest I think the dentist is being. So, yeah, I mean, this is really great. You know, we both got to run. We're both busy, but I appreciate those actionable tips. And so I guess if we were to sum it up in one word, it's really to really listen and show people that you care, because if you're able to recall what someone says, like, you know, early in an oral exam, maybe they might say,
Mhm.
oh, my mom lost all her teeth and I just don't want to lose all my teeth like that. Well, that's a very important thing to take note of,
Right.
and not only remember for later on in that appointment, but later on, years down the road, you can continue to bring that up. You know, if they need a dental implant, if they need whatever the case may be.
Mhm.
You know, what you originally expressed this to us about your mom lost her teeth and this, that, and the other, and you know, I think that really shows what. You know that you care, and that's really where you know, like when we're creating websites and we're doing videos of patient testimonials, that's what matters. It's not what
Mhm.
you say about your clinical skills. Sure, we'll mention CEREC, but for crying out loud, CEREC is not doing you not building trust. It's building
Mhm.
crowns, but it's not building trust.
Mhm.
So for all those CEREC doctors out there, keep CERECing, but just know that if people don't trust you, that machine is just going to collect dust.
Hmm.
So thank you, Dr. Angadi, for appearing on the show. Thank you for those tips.
Thank you for having me. I really enjoyed being here. And I think that, if anyone is into any type of personal development, definitely work on your own emotions with that, because when you know yourself, you know how to be more aware with everybody else. And it's talk talk if you're feeling burnt out, if you're feeling stressed, find outlets, take care of yourself, because you yourself as a provider have to feel fulfilled to be able to do what you do and do what we do to its full capacity. That's the thing that I want to leave anybody who's watching out there, because sometimes as clinicians we put everything into everybody else, and we don't take that step back to take care of ourselves and take care of what we need to take care of as far as our emotions and dealing with stress and life stresses. And it's a good thing to get the conversation out there.
Absolutely, absolutely. When the plane's going down, you put the oxygen mask on
Mm-hmm.
yourself.
Absolutely.
Then
Absolutely.
your child, because if you're not taking care of yourself, how are you supposed to help other people? So it's a
Exactly.
really great message. Okay, so they can find you on Facebook, The Inspired Dentist, if you search
Yes.
for that on Facebook.
Yes.
And thanks again for coming on to the show.
Absolutely. Thank you for having me.
And thanks for watching the Dental Marketing Guy Show.